Today we'll discuss how to make your own medical summary for going visit to the doctor. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. The headings in this video may not be applicable to all patients. This is just a general outline and guideline. It may be modified as per your own requirement and mainly meant for adults with prolonged medical history and senior citizens. So, when you go to a doctor, it is better to write a summary before you visit. So, people of prolonged history are usually elderly patients. They have multiple coexisting illnesses, and they may have to go to multiple doctors at multiple hospitals, and at various doctors you have to tell the same story that my grandfather or my father was ill since 10 years and he's been visiting so many doctors and he's visited this, and it's not possible for anyone to remember all the medical records. And not only that, if you go to the doctor, you may have to carry a suitcase of medical records. Now when you go to the doctor, if you got lots of papers, it may be difficult for the patient or the attendant and the doctor to summarize all the findings. Even if you go to the same doctor after a gap, he may not remember all the details, and it will be more difficult for the same doctor or various doctors if the history is very prolonged. You may be visiting several hospitals and you may get multiple thick files, and it's not possible for each doctor to go through all the files page by page. So it is better to make a summary before you visit the doctor. Disadvantages: it contributes to your avoidable time if you don't have a summary made. Increases the harassment for both the patient and the doctor. So it is better to carry a self-prepared medical history by yourself before you visit the doctor. So if you go through the medical records, they have many unnecessary papers such as hospital bills, electricity bill. I have seen people carrying school fee receipts and mobile bills attached to their medical records. They have duplicate reports. Same report has been xeroxed and have been attached to the file, and this creates unnecessary time and confusion. Medical records of family members are kept in the same file. This is also a big issue which I've noticed. So each family member should have separate medical records, and medical records are kept haphazardly, and it becomes very difficult for the doctor to understand what has actually happened with the patient. So it is better if you can type your own medical history before visiting a doctor or doctors. Save it in a Microsoft Word so that it can be updated at a later date. It serves as a record. So first of all, you have to arrange your papers. Most recent on top and oldest at the end. Remove all unnecessary papers such as bills. Make sure all records are of the same person. Avoid duplication of reports and discharge summary. Now case summary. So first of all, you have to write down the name, age and sex. Now age I generally don't like because every year you will have to update it. So sometimes I prefer to write down the date of birth. You can write down the height, weight in kg if you can. Also, if a person is losing weight, then the weight will change when the doctor visit to the doctor. Height will not change normally. Occupation can be added. Address, you can have a local address and a permanent address. And contact numbers in case the patient becomes unconscious, your family members. Now the same patient may be visiting various doctors. So Dr. YYY is a neurologist, is in hospital AAA, and give his contact number and any remarks. Dr. ZZZ is a cardiologist, He is in hospital BBB, contact number, and you must mention the name of the local doctor. He is a general person, clinic address, and his contact number. So this will help you whenever you go to the doctor, and the doctor advises for such. Just suppose you are visiting a surgeon, and then you require a he should be knowing that the patient is already on a treatment from a neurologist and cardiologist, and he is the general doctor. Now you have to just write down the complaints. So type your current medical complaints. Recent first. So fever since 2 days, abdominal pain since 5 days. You can write it like this. Then diseases cured or under treatment. So you can have, patient may have had tuberculosis, he may have had malaria, typhoid, foot injury or diabetes. Details of all previous admissions with dates and diagnosis should be mentioned here itself. Coexisting illnesses should also be mentioned, such as diabetes with the duration, blood pressure with duration, any heart problems, patient is a case of bronchial asthma, kidney disease, or has cancer. So each patient may have different set of problems, and you can write down, mention that what he has. Any surgeries that the patient has undergone. All surgeries done in the past should be mentioned. Recent should be first. So removal of appendix in the year you have to mention. Removal of uterus, cataract surgery, bypass surgery, and fractures in the year. So you can change this order, but the recent should be first, and if he's undergone any other surgery which is not been mentioned, you can add it by yourself. Details. Now if the patient has got some pacemaker implant, you should mention the details about that. Prosthesis, that is artificial metallic implant. Intraocular lens, power of glasses, etc. So all these should be mentioned. It will help other doctors to understand what he is having. And of course addictions has to be mentioned also. You may get an 80-year-old man who is addicted to tobacco or smoking. Check the previous reports. Now previous reports, patient has been there getting medical checkup for last 10 years. So you type them in Microsoft Excel with dates. And this is better for recurrent tests which are done very frequently, CBC, kidney tests, you get the liver function tests, these are done recurrently, blood sugar. So you can type them in Microsoft Excel with dates. Some tests which are done only once or repeated occasionally may be typed, such as biopsy report, endoscopy, or colonoscopy. So if the biopsy has been done twice or endoscopy has been done more than 2 times, 3 times, you type them at the same place with date. Now you may have previous films or tracings. So scan the films and save on same computer with date. So you may have the X-ray films, CT scan films, MRI films, ECG tracing, and others such as retinal scan. So you need to add them and with the reports. Family history. So if father and mother had any illness, this has to be mentioned. Brothers, sisters, number, age, and illness. So this can all be made in a tabular form. Show you. So here is the family history. Father is 75. He is a diabetic since 20 years and blood pressure since 5 years. Mother is 72. She had cancer and diabetes, and she had cancer of breast, and she expired 3 years ago. Self is 48 years old, blood pressure, and he's having blood pressure since 2 years. Brother is 45 years, no illness. Sister is 40 years old, gallbladder surgery 6 years ago. So this way you can write down the family history and it will be very convenient for the doctor. Allergies. So people may be some allergic to some drugs such as penicillin, sulfa, or painkillers. or they may be allergic to some food items such as peanuts, grains, fish, mushroom. Menstrual history, menarche and menopause must be mentioned. Date of last period should be mentioned. Pregnancy and breastfeeding. Number of children with age. So this should be made. So this can be again made in tabular form. Male, female. Of course, this is meant for a senior citizen. This is meant for younger people. Current medications. Now the person may be on a different treatment with different doctors. So patient may have multiple medications and multiple doctors. So you just keep them in a single list. Summarize the ongoing treatment. So here's the XYZ 3 different medicine, 50 milligram once daily 5 years, YYY is 5 milligrams, bedtime 2 years, ZZZ 10 milligrams twice daily for 10 days. Now finalizing it. Save it on a computer and you may take out printouts. You can, from the computer, you can save the documents on a pen drive or OTG. Save all the scanned films on the pen drive and /OTG. Create a hyperlink between the scanned films and tracing with the summary. Remember to make a reverse hyperlink from the films and tracing back to the summary. Then you have to give the final touches. This will require a regular updation, because if you go visit a doctor, he may change the treatment, and you may add a footer stating the last date of update. Advantages. Every doctor you visit, you may just have to show him the typed summary. It will save your time, his time and the attendant's time. And you don't have to carry the unnecessary documents. And you may edit it as per requirement. Just need to carry a few sheets of paper and or pen drive and OTG, and most of the people can understand what has actually happened. Continue with advantages. Now if you've got a soft copy on your computer, you can email it to your friends or relatives who are in other localities, or if you want the opinion of a second doctor, you can just email it. And you may share it with the doctor or hospital before actually visiting the hospital after taking. And this may provide better for online consultations for complicated patients. Thank you for watching the video. Please do not forget to like the video. Feel free to comment. Please subscribe to the channel and share link with your friends. Thank you once again.